Everyone ready? Okay, thanks. Thank you very much. I'm here to give you an update on the status of COVID-19 in New South Wales. And it's actually a very complicated picture, so I'm going to take it through slowly and then very much happy to answer any questions. So there were 14 new cases of COVID-19 were diagnosed in the 24 hours to 8 p.m. last night, bringing the total number of cases in New South Wales to 3,303. An additional 7 cases have been reported to noon today, linked to people at the hotel. So of today's new cases, 4 are returned travellers in hotel quarantine, and pleasingly the 2 residents acquired their infection in Victoria, but the pleasing component is that both cases were self-isolating on their return to New South Wales, and the cases have no identified close contacts in New South Wales because they followed the public health advice on their return from Victoria. 8 cases identified yesterday to 8 p.m. include 5 who attended the Crossroads Hotel in Casula, and 3 are contacts of cases who are at the hotel, and they are isolating. So the 5 cases who were at the hotel, including the Southwestern Sydney teenager who worked at the hotel on several days, including the 3rd of July and also the 9th of July, a Southwestern Sydney woman in her 40s who had dinner at the hotel on the 3rd of July, a Southwestern Sydney man in his 40s who had dinner at the hotel on the 3rd of July, a Victorian man in his 20s who had dinner at the hotel on the 3rd of July, and a Sydney man in his 20s who had dinner at the hotel on the 3rd of July. 4 of these cases were reported by media yesterday, with the addition today of the Sydney man in his 20s who attended on the 3rd of July. There were 3 cases who were close contacts of the cases who went to the hotel: a Southwestern Sydney woman in her 60s, a Southwestern Sydney woman in her 30s, and a Southwestern Sydney child. So today, an additional 3 cases have been identified in people who attended the hotel, including a Southwestern Sydney man in his 40s who had dinner at the hotel on the 3rd of July, and contacts with other cases in early July, a Southwestern Sydney woman in her 20s who was at the hotel on the 3rd of July, and a Southwestern Sydney man in his 30s who had dinner at the hotel on the 4th of July but had contacts with other cases early in July. So today, 4 cases who were close contacts of the cases who went to the hotel are 2 Southwestern Sydney teenagers, a Southwestern Sydney child, a Southwestern Sydney man in his 30s. And a further case was an indirect contact or a 3rd generation, a tertiary case of the hotel case, a Southwestern Sydney woman in her 50s. So if I summarise the number of cases, and remembering that there were those 2 original cases that we described, a Southwestern Sydney woman in her 30s who had dinner at the hotel on the 3rd of July, and a Blue Mountains man in his 50s who had dinner at the hotel on the 3rd of July, who also had 3 contacts who developed the infection. So in summary, at the Crossroads Hotel, we've got 10 linked to that, and then another 11 linked to those cases. And I think that this highlights the importance of the contact tracing efforts. And can I also thank very much the community for the response to present for testing. Those efforts have allowed us to identify all of these cases and effectively block any further transmission. And you can see that when we've got some cases that were actually contacts of cases, you can see how rapidly COVID-19 can spread if we do not act promptly. And I cannot express my gratitude enough to the health teams that stood up to undertake the testing, but most importantly, the community that have come out in such numbers to get tested and responding to the messages. There has also been some other sites that we do want to highlight, because obviously these cases did not realise they were infectious, and as I said, the infectious period can be before the period prior to onset of symptoms, and some people also had very mild and minimum symptoms. So One of the cases who attended the gaming room at the Picton Hotel on the 4th, 5th, 9th and 10th of July. The hotel has been closed for cleaning, but New South Wales Health is urging people who are at the hotel, especially those in the gaming room, to self-isolate for 14 days since they were last there, and to attend a clinic for testing, even if they don't have any symptoms, and watch for symptoms and get retested should any subsequently develop. And it's important that a negative test does not provide that clearance. We need you to be absent from that facility for 14 days since your last exposure. There's also a number of other venues that have been identified where the cases have potentially gone whilst infectious or potentially infectious. And we are being quite wide-ranging and identifying these sites and taking a very precautionary approach. So from the 6th to the 10th of July, one of the cases attended the Planet Fitness at Casula. On the 4th of July, one of the cases attended the Star City Casino between 2000 and 22:30 hours. On the 4th of July, Canterbury Leagues Club between 2300 hours and 0100 hours the following day. On the 5th of July at lunch at Cook at Cornell between 11:30am and 12:30pm. On the 5th of July, dinner at Highfield Carring Bar between 6 and 9pm. And the 6th of July, dinner at the Merimbula RSL between 6 and 9pm. On the 7th of July, breakfast at the Waterfront Cafe at Merimbula from 8:30 to 9:30am. On the 4th and 5th July, Murray Downs Golf Club. And the 6th of July, the Narellan Town Centre Shopping Town at Kmart, Target, Best and Lest, H&M and the food court area. And on the 27th of June, the Zone Bowling at Villawood between 11am and 3pm. So while investigations are underway, New South Wales Health urges anyone who attended these venues at these times to watch for any COVID symptoms, and if they occur, to isolate and get tested from COVID right away. So we're not actually asking people to isolate themselves. The interviews have highlighted that either the individuals were unlikely to be infectious at these times, or the nature of the contact at these venues was minimal, but we do want to highlight these settings and ensure that people are appropriately isolating. If information changes, we will provide an update. I would like to stress that we are extending the time of the COVID clinic at the Crossroads Hotel and looking at also for an additional sites. There will be a clinic at the Picton, at the Imperial Hotel in Picton, and that will be open from tomorrow. So just wanted to thank you and take questions.
So in regards to all those various venues you've just mentioned, just to clarify, one of the 21 people, whoever it was, has been to one of those venues. That's how it works? That's
correct. There were a number of those venues in the Merimbula and Murray Downs were related to two notifications we'd received in terms of Victorian visitors who were subsequently alerted to us by the Victorian Health Department as being positive. So some of those, particularly in relation to those sites, and we'll tease that out in the press conference, but they were related to visitors from Victoria.
So those Victorians, had they been to the Crossroads Hotel?
No, they had not.
So these are just
separate venues that be on alert. That's a combination of people, and we'll tease that out in the press release so that you can make it distinct. But there were two cases in Victorians who were holidaying here, who were subsequently notified to New South Wales Health that they were positive and potentially infectious, and some of those venues relate to those individuals. The others relate to cases associated with this Crossroads cluster.
Is that the Caravan Man? Those two venues in the shop?
No, they're additional to the your term, the Caravan Man. So no, they were additional, and they were just notified to us by Victoria Health.
And what about the 17-year-old who was in Tathra? Is that the Merimbula cases? Or?
No, that's a different case. So these are two new cases that have just been alerted to us that were in that when the contact tracing occurred, it was recognised that they had been in New South Wales. These cases were diagnosed in Victoria, and Victoria Health notified us late last evening, and these are the sites that those individuals visited.
Given that they did come up across the border, obviously either illegally or legally, does it go to show that maybe the border should have been closed sooner?
Look, obviously, we took a range of actions to message around not travelling to New South Wales, and requested that people out in terms with the hotspot areas were not travelling and were requested to self-isolate. So obviously the key issue that I'm focusing on is the fact that these individuals had presented for testing, we've diagnosed them, and we can then work with the community to get awareness out and for the community to come forward for testing. At the moment, whilst our focus is being drawn to the Crossroads Hotel, I think it's an important message for the community more broadly that this is a critical time where I urge you to come forward for testing. If you have an itchy, scratchy throat, a bit of a runny nose, the mildest of symptoms, please come forward and get testing. You can see that through the initiatives of the doctors in these cases that undertook the testing, how we have then been able to intervene, recognise these cases and block chains of transmission. And so that's my one message to the community. Please come forward for testing. I would also like to urge those people who have been particularly anywhere in Victoria, but in particular the areas of Greater Metropolitan Melbourne and the Mitchell Shire, it is incredibly important that you adhere to the self-isolation requirements and that you present for testing with even minimal symptoms.
Has there been anyone who was let off the Jetstar flight from Melbourne without being screened in Sydney that's since tested positive to COVID-19?
No, I'm not aware of any of the passengers on that flight being tested positive.
Just back to the Crossroads Hotel, do we know anything about the identity of the patient zero, so the person that kind of started that cluster? And if so, did they sign in when they came into the pub? And if so, did it indicate that they were from Victoria?
So our investigations are ongoing as to the source, and as it's very important that we investigate this thoroughly before disclosing what we think is the origins. We are awaiting further testing results, and I'm expecting those results to be in the next few days, and at that point we can update you. But clearly we are pursuing, it's a pivotal part of the investigation is whether these cases can be linked to any travellers from Melbourne, because that gives us comfort that we're not missing another avenue of transmission. So obviously we're working very hard to establish the source, the initial index case, but it's premature to speculate. We need some further testing and specialised genetic testing of the virus strains to see if it matches.
Do you suspect that it could be one of these that you've already caught?
No, we actually think, we do have some avenues of investigation that we are pursuing, and it does revolve around, it is related to some of the individuals that I've disclosed associated with the Crossroads.
Is it are we worried about the Victorian people who have been there?
Obviously a hypothesis is that this may have been introduced through contact in Victoria, but we have to remain open-minded. What's most important is we don't go down one path without keeping a very open mind. I think it's premature for me to conclude how this came about. I need a few more days to do the relevant testing to inform my views.
Did Crossroads Hotel follow its COVID safe plan?
The Crossroads Hotel had a COVID safe plan, and we were able to get contact details of a large number. When we've asked and requested the lists, we were provided with them, and we have been using them. I think the issue of implementation is probably something that we need to look at. Environmental health officers have been at the hotel, and I would like to acknowledge the fact that the hotel's been very cooperative, but that's probably for a discussion after we get over this hump of trying to identify all cases.
Are you looking at truck drivers who may have stopped off at the hotel between the Sydney-Melbourne run?
We certainly have made, because we recognise the location of this hotel is on main transit routes, we have been working with our colleagues in other states and territories to ensure that they're aware of this cluster of outbreak, and they can take appropriate actions in increasing awareness through those states and through the freight network and others who may be just travelling through. This is called the Crossroads Hotel for a reason. It is on a popular route, and we want to make sure that the message is far and wide. But we do work very cooperatively across the states and territories and share information. So from the earliest stage, we have been sharing this information with our colleagues in other states and territories.
And has the COVID Safe app helped in tracing the cluster from the Crossroads Hotel?
We continue to incorporate questions around the COVID Safe app in our contact tracing. It hasn't been the major feature. Clearly the record keeping and the fact that we were able to identify people who attended the day. But also, can I just say, the media and getting the messages out, we've seen an incredible turnout of the community. And again, can I extend my appreciation to the community for that massive turnout.
There were some contact tracers that we sent down to help in Victoria. Have we recalled them?
So in terms of the contact tracers, we can do that effectively remotely. And so we've done over 300 case interviews for Victoria. At the moment, some other jurisdictions are also coming on board to support Victoria, and at this moment we're focusing primarily on the extensive contact tracing around these cases, and but we remain ready to, once our workload dies down, to resume our efforts in relation to supporting our colleagues in Victoria.
There've been fairly long waits at the pop-up clinic at Casula. Are you extending the opening hours? Are you setting up other clinics? So
the opening hours are being extended tonight, and we'll have the timelines for that, and we are looking at the possibility of extending, setting up another clinic in close proximity to Crossroads. I would urge the community to also take advantage of the clinics at Campbelltown, Liverpool and Fairfield if they live in those areas and it's equidistant for them to travel. And I acknowledge the patience of those people who have been at the Crossroads Hotel, and again, just thank you so much to the community for coming out and getting tested.
There's a testing clinic at Moorebank as well. Did they run out of test kits today and have to turn people away?
Look, I believe that relates to a private GP clinic that did run out or have some challenges with swab availability. Again, that's probably all I can say. It's a matter for them, but clearly we do also encourage people to get testing at their GP if that is more convenient for them.
Also, Dr. Chan, what is your advice on masks? So now, given the number of outbreaks in Victoria and also here, do you suggest that everyone should be wearing them, or is that only for people who are sick?
So the first line of defence is we don't want you out and about when you've got any symptoms, however mild. Now's not the time to be going to workplaces, to pubs, clubs or anywhere if you've got any symptoms. Please act cautionary. If you are out and about and you can't socially distance, then wearing a mask is a reasonable additional measure that you can put in place, but it shouldn't be at the expense of social distancing, and we wouldn't want people to fall into a false sense of security in relation to the need not to socially distance. When you're wearing a mask, it's important that it covers your nose and mouth, that you don't continually adjust it, and that you discard it safely and do not touch the front of the mask and contaminate surfaces. So it's important that if you are going to use a mask and you in those situations where you can't socially distance, then just also follow those simple hygiene measures when you're wearing a mask.
With Casula, will you recommend to the Premier that we may need to lock down that suburb?
At this point in time, our efforts are focused on getting high rates of testing, and whilst the fact that I'm announcing that we've had 21 cases linked in one way or the other to the Crossroads Hotel or that cluster, to some extent that represents a success, because every one of those cases we can find, we can stop that ongoing transmission. I do urge anyone in the community to come forward for testing, even if you haven't been at the Crossroads Hotel, because we want to get any indication that the virus has spread more broadly in the community. At this stage, all of the cases that have been notified, and this situation can change rapidly, but to date, or just before coming into this press conference, all of the cases have been able to be linked to either attendance at the Crossroads or contact with another known case. If we see any emergence of cases that are not linked to the either known cases or the Crossroads, attendance on those days, then obviously that will lead us to reflect on additional measures we need to take in that area.
In terms of hotel quarantine, why have there been some people allowed out of their hotel quarantine before the 14-day period?
So that's probably a matter for police, but there are a small range of exemptions that are in place where people are given exemptions, but it's a very small group, and police probably can best answer that question in terms of any leave beforehand.
And are we thinking anything about New South Wales locking down again? Is that on the cards at all? As I said, we're just continuing to monitor this situation very closely, and we continue to reflect on what additional measures we need to have in place. But my key messages to the community at this stage are come forward for testing. I would love to see the testing rates hit that 20,000 every day of this week, and I challenge the community to come forward. I need to get all members of the community, so it's very important that in discussions with younger people who we know who are underrepresented in the testing, particular groups that may be concerned about going and get tested, that we actually all support each other to get tested at this critical time. Finding the cases will allow us to best understand if we have missed any chains of transmission, and will allow us to prevent community transmission taking hold in New South Wales.
With the Star Casino case,
Last question, guys, please.
was this person at Star Casino symptomatic? And how many people do you know yet were exposed to that person?
My understanding is that the person did not have symptoms when he attended the Star City Casino, and he may well not have been infectious. It's sometimes unclear, particularly when people have very mild disease, about the exact time of onset or the time of infectiousness. We also are advised that he was largely maintained within his group and really did not interact with anyone else. But obviously, for the abundance of precaution, we've let the community become aware of the sites where people may have been at who may have been infectious. But as I said, we're taking a very precautionary approach. And the key message is anyone with symptoms, please present for testing. And anyone who's been at that hotel between the 3rd of the 10th of July, the Crossroads Hotel, we're asking you to self-isolate, and please get tested regardless of whether you've got symptoms. But remember, even if you return a negative result, please stay isolated for 14 days since your last exposure to the hotel, and particularly like to also call out those that attended on the 9th of July at that Crossroads Hotel.
Doctor,
Thank you.
There does seem to be a link here, sorry, there's a link here with poker machines, and several of these venues have poker machines. Have you got to look at that issue in particular, given the hard surfaces and so forth as well?
When we've done the case, history is clearly that some people were playing poker machines, but it isn't a strong feature. A lot of them were consuming meals, and it was a party or a celebration for various work events, as opposed to us being concerned that the poker machines. Clearly we have strong guidance about the fact that when you're with any fixed hard surface and you've been there for a while, we need to have good cleaning regimes to wipe down the surfaces after you've finished using it. And they're sort of elements that we'll follow up with the various hotels, but that wasn't the major driver from what we can see in terms associated with the cases.
Thanks, guys.
Thanks.
Appreciate it.